Hi, it's Nicki Williams here, and I've got a very special person here today with me. It's my dad, and he is Dr Bernard Willis. He's an integrative family doctor who works out of Auckland in New Zealand. I'm based in London, so we don't get to see each other very often, but we're here in California, and he's come over for a holiday, as it's only halfway, and he's agreed to have a chat with me about hormones and his work. And welcome, Dad.
Hello, great. Lovely to be here.
So you've been a doctor for over 40 years. What changes have you seen in all that time?
Well, I think that probably the most definite change has been the rise in obesity, and because of the terrible diets that we eat these days, processed food has caused us to be a nation of carbohydrate addicts and obese people, and it's also produced an epidemic of diabetes, not just in elderly people, but in young people. And when I first started in medicine, diabetes was a disease of the late onset, middle age and onwards, and now it's become a disease of young children because of what they call the SAD, Standard American Diet. The other thing that's happened in greater frequency now are autoimmune diseases, things like rheumatoid arthritis, Hashimoto's disease, psoriasis, MS. These are all diseases which have become more prevalent these days for many reasons. Virus infections are more common. Environmental pollution has caused a lot of them. And we're dealing all the time with autoimmune diseases which are quite hard to treat.
You think it's easier or harder to treat people these days?
I think it's much harder to treat people these days because in the old days I think patients gave their doctors more leeway. They didn't expect a sudden instant cure, and of course in those days they weren't the new drugs that we have now and technology that we have now.
And do you find people know a lot about their disease when they come to see you already, from Google and reading they do?
Oh yeah, everybody consults Dr. Google before they consult me,
yeah.
Definitely. That's normal these days, but the problem about that, they can get a lot of too much information, misinformation and overload from the internet, which does nothing more than confuse them really.
There's a lot of fake stuff out there, isn't there, and very confusing messages for people trying to find good treatment options, isn't there?
Yes, you've got to know the sites that are valid, and because there are a lot of people out there that want to sell you their supplement or their latest new cure, and you've got to be very careful. You've got to really know what you're looking for, and you need, I think, an integrative doctor or a naturopath who knows something about these things to point in the right direction.
What do you see happening in the next 50 years or so?
Well, I think the pace at which modern technology is going, it's an exponential growth in new technology, new treatments, and that's just going to continue. I think just around the corner we've got stem cell treatment, which is going on already. We no longer have to go to fetuses, fetal stem cells. We now can make stem cells any part of the body from your skin. So that's going to be wonderful. And then the other thing along the horizon is what we call nanotechnology, in which tiny little microscopic computers would be inserted into the body, and they will roam around the blood circulation, picking up viruses, dead cells, cancer cells, and also they will actually replenish your red cells. You have little robots which will become new blood supply for you.
Wow.
And cell repair. This is probably about 20 or 30 years away from now. It's not a million years in the future.
What made you turn towards nutrition and lifestyle treatments in your medical practice?
Well, I think it was a sort of a wake-up call about 20 years ago when I was working in Spain at the time. I was running 3 clinics and was working so 24/7. Got really stressed and picked up a virus called cytomegalovirus. It's similar to glandular fever, okay, and we normally pick it up with no problems at all. We just pick it up and we don't suffer from it. It just happens to us. But if your immune system is low, if you're under stress, then it can cause problems. And it hit me, gave me a chronic fatigue syndrome. I hit the wall and couldn't work for a year. I was so weak I could hardly get off the couch for 6 months, and that sort of made me go and see other doctors. I saw specialists, neurologists, physicians, and in the end psychiatrists, and all they could offer me were drugs.
Did they know what it was?
Yes, the blood test showed up that it was on the blood test that it was a high titer of a CMV virus. but they had no way of treating it, only symptomatically. So in the end, they said, well, you need to go on Prozac, and I said, no thanks, I'm not going down that road. So in those days there was no internet, so I had to go down to the library, stack at the library and research it. I looked every book I could find on natural treatments, and eventually changed my lifestyle, changed my nutrition, took some nutraceuticals, and balanced hormones, and took a lot of rest, of course, as well, and eventually got over it. And that was the moment. There was like a flash of lightning that occurred in my thinking about medicine, that pointed me towards a natural direction, the direction away from drugs, because drugs couldn't help me, and in the end, for chronic fatigue, drugs are not very effective.
And did you notice the effect straight away with your patients?
Oh, very much so, because you deal with a lot of things without having to give them drugs, and a lot of time the patients were very grateful for not having to take drugs. Yes. I mean, drugs are important. We all need drugs. If I had a heart attack, I want some drugs. Yeah. And I was injured in a traffic accident, I'd want drugs. But modern doctors and surgeons are very good at putting people together after acute injury or acute episodes of disease. But for chronic disease, they've got it wrong. It's not working. Modern medicine's not working with chronic disease, and the only way to go is to try and find the cause of the problem, right, rather than just putting a sticking plaster over it.
And food can be very powerful, can't it?
Yeah. You eat, and if you give your body the right conditions, it will heal itself.
What are the most fulfilling parts of your job?
I think restoring people to health who've been chronically ill for many months and sometimes years, people who've been to other doctors, specialists, and have not got the answers that they wanted, and they often come to me as a last resort. People like me. There are about sort of 6 or 7 doctors, integrative doctors in Auckland where I work, and what happens, of course, is that they've seen everybody else. They've had lots of tests done, and they've had lots of investigations done. And what I do, I'm more like a medical detective than a doctor. I actually go and look for the clues and find out the causes of their illness, if it's fatigue or pain, headaches, migraine, whatever. And then obviously try and deal with the causes. And that's the only way in the end to cure something.
Do patients have the patience, pardon the pun, but do they have the patience to stick it out? Because sometimes, doing that can take a long time, can't it? Yeah,
sometimes there's no quick fix. If you're trying to find it's a bit like I use the analogy of trying to solve a murder. If you go down one lead and it comes to a dead end, then you search for another lead, another clue, until you find it, and that can take several months. And I say to patients when I first see them, look, I can help you, but it's not going to be a quick fix. It's going to take time. And the patient needs to be motivated, and sometimes they need to have some financial resources too, because a lot of the tests and supplements I do are not funded by the government, and they can be expensive. So, but I think at the end, people who have been chronically ill for so long, are motivated to get better, are prepared to go down that track.
Right. I mean, one of the challenges for health practitioners in general is patient compliance, isn't it? Because if you're asking them to do difficult things like changing their diet and their lifestyle, for some people it's a huge ask. How do you improve your compliance rates with your patients, and how do you motivate them?
Well, I think if they're coming to see me, they're pretty motivated already, because they've been to see other people. But I think if you point out to them, the benefits they're going to get, and then maybe even just after a few weeks with a few sort of appropriate supplements and diet changes, they feel better already, and I think that gives them motivation to keep going. For instance, diabetes type 2, in my experience, is reversible. Given a motivated patient, and given somebody who's prepared to change the diet, exercise, and take the supplements, and most of the time you can reverse diabetes without using drugs. And that's just one example.
Right. So what are the most challenging parts of your job?
One of the most challenging parts of the job is making sure that you don't run foul of the orthodox authorities. I mean, we've all got to keep our licenses to work, and we've all got to be governed by a medical council, and they make the decisions. And a lot of people that sit on medical councils obviously don't always look outside the box. They don't always agree with what we're doing. So you have to be careful when you're putting your head on the parapet that they come and chop it off. Yeah.
I'm guessing you can be quite unpopular with some of your treatments.
If you're outside the box and your treatments don't always agree with the orthodox norm, then you are taking a risk, yes. But it's important that you can back up your treatments with science. Mm-hmm. If you do that with science, with good research, evidence-based research,
yeah.
then you're on much steadier ground. Yeah. I try not to do anything that's wacky or off the wall or something that hasn't got some evidence behind it.
Right. Do you have any advice for nutritional therapists just starting out?
Yes, learn all about learn all about what vitamins and supplements do, and how they interact. It's all very well to know that vitamin C is an antioxidant, but we need to know how the vitamin C reacts with the vitamin A and the vitamin B and everything else in the body. And if your patient's on drugs, how they can also react with drugs. Mm-hmm. So that's very important. And don't overdo your supplements, because you can have too many antioxidants as well as too little. But people with chronic illnesses, people with chronic fatigue syndrome, MS, often can't tolerate supplements very well. So it's very important you don't give too many at once. Try them on sort of one for 2 or 3 days, see how that works, then another one in. Because otherwise they're going to have severe side effects, and they're not going to thank you for that.
Mm-hmm.